Prime Minister met on Monday, the 15th of this week. I had been meeting with the management teams. Digital healthcare. Milestone reached as all GPS adopt new information system. MP Egbert Doran, on the advice, was addressed against the following relevant legislation. The Ministry of Justice has made recent working visits to Trinidad and the Netherlands. From the island, St. Martin, this is SXM Daily News for June 17th, 2026. The Ministry of VSA. Date of the 4th of June, 2026, and the acting, and already on Monday, the 15th of this week, I had been meeting with the management teams of the Ministry of VSA. It was a very effective, constructive, and informative meeting that we had with each other towards the community of St. Martin.
First of all, regarding the factual review by the Ministry of VSA. To start with, as of the 4th of June 2026, I'm the acting Minister of VSA. And already on Monday, the 15th of this week, I had already a meeting with the management teams of the Ministry of VSA. It was a very effective, constructive, and informative meeting that we had with each other, with the main purpose to continue giving continuity to the VSA services towards the community of St. Martin. But over the past several weeks, various allegations and statements have been circulated publicly regarding the Ministry of VSA and by extension also regarding my role as acting Minister of VSA. Given the seriousness of these allegations and the importance of maintaining public trust in our institutions, I requested a factual review by the Ministry's administration to determine whether any formal complaint, reports, documented concerns, or official allegation has been submitted through the established administrative channels. The review was conducted by the Secretary General of VSA, and the following has been confirmed. There are no formal complaints filed in the Ministry of VSA. There are no official reports submitted. No documented allegations were recorded. No requests for intervention were received through established ministry procedures. No evidence was found supporting the allegations that had been publicly suggested, also directed to me. These findings are, I think, very important because they distinguish between speculation, verified facts, and of course the overwhelming political rhetoric that actually nowadays is bringing a lot of unrest in the community, and I think unnecessary, and actually hampering a stable, healthy progress of this country. The government of St. Martin fully supports the right, of course, of every civil servant to raise concerns through the appropriate channels without fear or of retaliation. That is very, very important. Those safeguards remain firmly at place. We have to make sure that we have a healthy working environment. At the same time, allegations must be supported by evidence and addressed through established procedures. Public accusations alone do not constitute proof, of course. The factual review has now been completed, and the findings are evident and clear.
Minister of Justice Natalie Tackling, speaking at the Compress briefing, also wants to take this opportunity to encourage all road users to exercise caution and responsibility. Whether you're driving a car, riding a motorcycle, or using our roads in any capacity, The decisions that you make behind the wheel have real consequences. Road safety is a shared responsibility, and every life lost is one too many. The Ministry of Justice has remained active on multiple fronts. While much attention has been given to my recent working visits to Trinidad and the Netherlands, it's important to note that the day-to-day work of the Justice team continues uninterrupted.
I also want to take this opportunity to encourage all road users to exercise caution and responsibility. Whether you're driving a car, riding a motorcycle, or using our roads in any capacity, the decisions that you make behind the wheel have real consequences. Road safety is a shared responsibility, and every life lost is one too many. Turning now to the work of the ministry. Over the past several weeks, the Ministry of Justice has remained active on multiple fronts. While much attention has been given to my recent working visits to Trinidad, Vienna, and the Netherlands, it's important to note that the day-to-day work of the justice chain continued uninterrupted. During my work visits, I represented St. Martin during a series of international and kingdom-level engagements, including the Caribbean Financial Action Task Force, the CFATF, in Trinidad, the United Nations Commission on Crime Prevention and Criminal Justice, the CCPCJ, in Vienna, and a subsequent work visit to the Netherlands. These engagements focused on issues that are directly relevant to St. Martin, including financial crime, youth violence prevention, illegal firearms, cybercrime, border management, detention reform, rehabilitation and reintegration, and institutional strengthening. At the Caribbean Financial Action Task Force meetings in Trinidad, discussions focused on St. Martin's ongoing efforts to strengthen its anti-money laundering and counter-terrorist financing framework. This work is important because it directly impacts the integrity and reputation of St. Martin's financial sector and, by extension, confidence in our wider economy. While progress made over the past year was recognized and applauded, it was also clear that significant work remains to address outstanding deficiencies and successfully exit the current follow-up process. A key message from the CFATF Secretariat was that although St. Martin's next evaluation isn't scheduled until 2032, that the preparation cannot wait until then. The readiness window opens much earlier, actually from 2027, it's the period 2027 until 2032, and meaningful preparation must begin soon if we are to achieve a successful outcome in 2032. The ministry has already begun taking steps to position St. Martin for this next phase. In the coming period, we will continue to work with our local, kingdom, and international partners to strengthen coordination, address outstanding gaps, and ensure that the necessary foundations are in place well ahead of the next evaluation cycle. In Vienna, I attended a series of bilaterals and tripartite meetings with UN experts and contributed directly to the international dialogue through two side events held during the Commission. At a session focused on advancing access to justice for women through the implementation of the Bangkok Rules, I highlighted the importance of gender-responsive justice systems and the need to ensure that rehabilitation, reintegration, mental health support, and family connections form part of justice responses for women and girls. The Bangkok Rules are a set of 70 international standards adopted by the UN General Assembly in 2010 that outline the distinct needs of female offenders and prisoners and how to address those needs, considering that standard prisons are typically designed for men. I also participated in a side event on penal reform in small island contexts, where I shared St. Martin's experience under the Detention Sector Reform Program and discussed the unique opportunities and challenges that we face as we pursue detention reform. These engagements provided an important opportunity to ensure that our experience and perspective remain part of the broader international discussions on criminal reform. The working visit to the Netherlands built directly on many of the discussions that took place in Vienna. While the Commission focused on broader international developments and emerging challenges, the meetings in the Netherlands allowed us to explore how some of those discussions translate into practical support, expertise, and cooperation that benefit St. Martin. Conversations focused on issues such as youth crime prevention, illegal firearms, customs modernization, border management, financial intelligence, detention reform, rehabilitation, and institutional capacity building. I'm excited to provide further updates on these topics as they continue to develop over the coming months.
Sint Maarten has reached a major milestone in the modernization of healthcare, with all general practitioners, GPs, on the Dutch side, now connected through a digital general practitioner information system, GPIS, implemented through the coordinated efforts of SCV Social and Health Insurances and the country's healthcare partners. The implementation marks an important advancement in SCV's broader healthcare transformation agenda and represents a significant step toward more connected, efficient, and patient-centered healthcare delivery on Sint Maarten. The GP information system enables healthcare providers to securely register, manage, and exchange patient medical information digitally. The system improves access to important patient information, streamlines administrative processes, and strengthens collaboration between healthcare professionals across the healthcare chain. One of the first major milestones already achieved through the system is the electronic reception of laboratory results directly within GP practices. Previously, laboratory results and patient updates often required additional manual follow-up or paper-based exchanges. Through the new digital system, healthcare providers can now access information faster and more securely, supporting more efficient patient care and follow-up. For patients, the system contributes to safer and more coordinated healthcare experiences. For example, when a patient with chronic conditions requires follow-up care or visits another GP, the physician can more easily access relevant medical history, allergies, medication information, and previous results within the system. This supports faster and better informed medical decisions and improves continuity of care for the patient. For general practitioners, the system reduces manual administrative processes, improves patient record management, and supports more efficient communication and monitoring of patient care. The digitalization of information also creates better opportunities for long-term healthcare planning, chronic disease management, and data-driven healthcare delivery. For SCV, the implementation represents an important technological achievement that supports the organization's commitment to innovation, healthcare sustainability, and improving service delivery within the healthcare sector, placing Sint Maarten among the growing number of Caribbean countries, modernizing primary healthcare through digital solutions. The digital infrastructure now established also lays the foundation for future healthcare modernization initiatives, including electronic prescriptions, e-prescriptions from GP practices directly to pharmacies, improved medication monitoring and control, enhanced healthcare reporting and insights, better coordination within the healthcare chain, future integration with additional healthcare providers and digital healthcare services. The next phase, the electronic transmission of prescriptions to pharmacies, is already underway and expected to become available in the near future.
Are you SXV insured? Do you have a valid medical insurance status? SXV is cardless. Request your My SXV account today and enter the virtual office of SXV. Go to szv.sx and sign up now.
Your social health insurances.
NVGEBE Supervisory Board for clarity on the current composition, mandate, and operational status of the Supervisory Board, as well as any recent or pending decisions impacting corporate governance. Update on unrest by middle management to remove the CEO by a specific date, in particular, a detailed briefing on the government's position, planned interventions, and anticipated implications for the company's stability. Parliament meeting of June 12, 2026.
At the time, the government requested the RAC combined with the BTP to look into the tariff structure of the company. And a report was made, and the Prime Minister was very glad with that and ran to the Supervisory Board that time, not now, that time, before this new board was installed. And the Supervisory Board accepted the report but did not give follow-up to the report, while there were some suggestions in the report. And that is, of course, very frustrating for the government, but it is what it is, because that is the governing structure of the corporate governance that the government, the shareholder, has to adhere to. Madam Chair Lady, number three, you requested that the Supervisory Board of Directors step down. Where are we with that process right now? What has been the next step since your request? If the entire board is sent home, what will be the reporting structure look like in the meantime? What is your plan when you execute this request? The answer to this question is, Madam Chair, a new supervisory board has been appointed already to the NVGEBE since February 2026.
Thank you, Prime Minister. Now I'll allow MP Lewis to make his interruption. MP Lewis?
Madam Chair, again I will repeat this. When I sit here, I represent this country, whether my mouth loud or not, Madam Chair. The Prime Minister needs to understand that this is the people's house, that 15 of us here represents, and not him. He needs to understand, Madam Chair, that the people need to be respected, and I will repeat it again. Not to be fooled by the rhetoric of the Prime Minister, Madam Chair, or his foolishness that he can bring in here. The people are requesting for a relief. The Prime Minister has been the chairman of the Council of Ministers since 2024 May, Madam Chair, which I sat in that council, which I also sat with GB as well. I also told GB at that particular time to get their house in order. Understanding government so far, Madam Chair, the Prime Minister is responsible to give the people relief, and he is weighing it in on GB. The Prime Minister also mentioned that the Minister of Finance, NTIAT, are basically
Lewis,
looking into a relief, Madam Chair, and I'm going to make it clear. The people want to know when they are going to get relief. Don't come in here and tell me stupidness. Thank you, Madam Chair.
Prime Minister, you may continue.
Thank you, Madam Chair. I'm moving forward to question number 4. During a year-and-a-half term of the Prime Minister, 3 seats on the board remain vacant. If relief and governance are so urgent, why weren't these positions filled to strengthen the board's capacity? At this particular moment, the answer is that at this particular moment we have 3 board members installed at the level of the Supervisory Board of Directors, and still we are working to add 2 candidates to fill the 2 vacancies at board level of the Supervisory Board of Directors of GEBE. Madam Chair Lady, number three, you requested that the Supervisory Board of Directors step down. Where are we with that process right now? What has been the next step since your request? If the entire board is sent home, what will be the reporting structure look like in the meantime? What is your plan when you execute this request? The answer to this question is, Madam Chair, a new supervisory board has been appointed already to the NVGEBE since February 2026.
Thank you, Prime Minister. Now I'll allow MP Lewis to make his interruption. MP Lewis?
Madam Chair, again I will repeat this. When I sit here, I represent this country, whether my mouth loud or not, Madam Chair. The Prime Minister needs to understand that this is the people's house, that 15 of us here represents and not him. He needs to understand, Madam Chair, that the people need to be respected, and I will repeat it again, not to be fooled by the rhetoric of the Prime Minister, Madam Chair, or his foolishness that he come bring in here. The people are requesting for a relief. The Prime Minister has been the chairman of the Council of Ministers since 2024 May, Madam Chair, which I sat in that council, which I also sat with GB as well. I also told GB at that particular time to get their house in order. Understanding government so far, Madam Chair, the Prime Minister is responsible to give the people relief, and he is weighing it in on GB. The Prime Minister also mentioned that the Minister of Finance, NTIAT, are basically
Lewis,
looking into a
short.
relief, Madam Chair, and I'm going to make it clear. The people want to know when they are going to get relief. Don't come in here and tell me stupidness. Thank you, Madam Chair.
Prime Minister, you may continue.
Thank you, Madam Chair. I'm moving forward to question number 4. During a year-and-a-half term of the Prime Minister, 3 seats on the board remain vacant. If relief and governance are so urgent, why weren't these positions filled to strengthen the board's capacity? At this particular moment, the answer is that at this particular moment we have 3 board members installed at the level of the Supervisory Board of Directors, and still we are working to add 2 candidates to fill the 2 vacancies at board level of the Supervisory Board of Directors of GEBE. Question number 5 of MP Lewis. Do you intend to fill these seats quickly after sending home this board, or will they remain empty as well? Or is it just about pointing fingers about something else instead of taking accountability? It's not that the former board was sent home. The former board resigned voluntarily. That is, I think, something that has to be clear, and we didn't send no board member home.
MP Egbert Doran, on the advice, was addressed against the following relevant legislation. Articles 36 and 14 of the National Ordinance of Public Health, Articles 2 and 3 of the National Ordinance Regulating the Practice of Medicine, Article 34 and 5 and 7 of the National Ordinance on Healthcare Institutions, as well as the Ordinance. Consideration of the Public Health Council. The Chairman and all the attendant members review the submitted request. The Council deliberated on the matter on June 10, 2024, so 2 years ago today actually. What a coincidence. Hereby issues the following advice.
Because again, Madam Chair, I believe that the public not having all the relevant information, sometimes messages can be confusing. So thank you for your indulgence. I'll go into the following. I'll just breeze through this advice. Advice on the facts. On the 20th of May, 2024, so this is about 2 weeks after this government swearing, through you, Madam Chair, the Public Health Council, herein referred to as the Council, were asked for advice. I'll just breeze through it. The aforementioned request advice was addressed against the following relevant legislation: Articles 3, 6, and 14 of the National Ordinance on Public Health, Article 2 and 3 of the National Ordinance Regulating the Practice of Medicine, Article 3, 4, and 5, and 7 of the National Ordinance on Healthcare Institutions, as well as the KZ Ordinance. consideration of the Public Health Council. The chairman and all the attending members reviewed the submitted request. The council deliberated on the matter on June 10th, 2024. So 2 years ago today, actually. What a coincidence. Hereby issues the following advice. The council carefully examined the application of the healthcare institution license submitted by the individual and has reached the following conclusion. From the file presented to the council, only the following qualifications were evident. A university bachelor's degree in medicine, geneeskunde, university master's degree in medicine, also geneeskunde. Furthermore, it appears that from the big register, the individual is a registered physician. However, in order to function as a general practitioner, family physician, one must complete the specialization in general practice medicine. This individual has not completed the general practitioner training program, as a result, cannot function as an independent general practitioner. In addition, the individual has insufficient work experience, which constitutes further concern for the council. Therefore, the council considers it irresponsible to allow the individual to practice independently as a general practitioner without the special prerequisites as a professional individual would require. Madam Chair, we've been talking about this for weeks now. We even heard some new ways of spinning the truth today. And I just want to say 2 feedbacks through you to the Prime Minister from some colleagues of yours that are watching this meeting. Why is he being dishonest? The other one mentioned, sad to see the PM digging a deeper hole for himself. A general practitioner is the same as a family physician. This is pure wordplay. The doctor in question is just what you call a junior doctor, only allowed to work in a hospital under specialized supervision and not in a GP medical clinic. Thank you very much, Madam Chair.
MP Shamira Roseberg and MP Lyndon Lewis, on the advice, were addressed against the following relevant legislation.
Madam Chair, through you, just to clarify and also to make it clear that this clarification is not for the sake of loyalty, as I don't operate as such, but for the case of transparency and clarifying the matter. It was mentioned here today on the floor of Parliament, I think it was a question of MP Irion, that, and I'm not sure if I understood it correctly or heard it correctly, maybe the Prime Minister misspoke or forgot, through you, Madam Chair, that no mediation was started. Was that the answer? Or did I hear it correctly that no mediation was suggested and or requested? Because I can recall that among myself, and I don't want to cry over spilled milk, it is already a station passé, but seeing that we're talking about the matter here on the floor of Parliament, I do believe it's important to have that clarified, because I can recall that I was one of the persons that requested and suggested mediation before going to the final stage. And I'm just mentioning this here today because that question was asked, and I do believe it's important to be transparent in that sense, because I also mentioned it on the radio, and I don't want to come over as someone that is not speaking the truth. So maybe it was forgotten, or I didn't hear the question correctly, or the answer to the question correctly. So if that can be clarified, thank you.
I would like to know, Madam Chair, how did the Prime Minister got whiff of it? How did he got his hands on it? Did he ask, I need him to clarify, did he ask the cabinet to give him that? Because you can only know about this if it's within the minister's queue, and that was for the Minister of VSA at the time. And this advice apparently was on the table of the former Minister of VSA before Minister Brook, which is Veronica Janssen. And I would like to know, how did it reach in the Prime Minister's hand to sign? So I would like to know, how come the former Minister of VSA, Veronica Janssen, did not touch that advice at that particular time? Then Minister Brook inherited it. And then the Prime Minister himself, as acting Minister of VSA, signed it. So Madam Chair, I would like him to clarify how did he, as the Prime Minister, as acting Minister of VSA, 2 ministers before him did not sign that document, but he got it. Thank you, Madam Chair.
Now for the weather forecast, today through Thursday morning, partly cloudy. Isolated showers are likely. Surface winds, today through Thursday morning, easterly with a gentle to moderate breeze at 8 to 15 mep. Higher gusts are possible. State of the sea, slight waves, swells 2 to 4 feet. Outlook through Friday morning, occasionally cloudy, breezy, and slightly hazy with isolated showers. And now your 3-day forecast.
Your social and health insurance is your social and health insurance.
Are you SXV insured? Do you have a valid medical insurance status? SXV is cardless. Request your My SXV account today and enter the virtual office of SXV. Go to sxv.sx and sign up now.
Your social and health insurance.
United Nations Secretary-General Antonio Guterres has called on the international community to step up its support for Haiti, warning that global indifference is as damaging as the country's escalating gang violence. Wrapping up a one-day visit to Haiti on Tuesday, Guterres said he was encouraged by what he described as early signs of progress in the country's political transition, but stressed that sustained international engagement was urgently needed. A dynamic is there, and my call to the international community is therefore simple. Finally, assume your responsibilities, he told reporters at a news conference following meetings with Prime Minister Alex Didier Fils-Aimé and other officials. Guterres said Haiti's crisis was being deepened not only by armed gangs, but also by the lack of sustained global attention. The biggest wave is indifference, that of a world that has looked elsewhere for too long, he said, adding that there was a direct link between the absence of the international community and the absence of security for the Haitian people. He pointed to recent developments as signs of gradual progress, including the return of government activity to the National Palace and the recapture of some neighborhoods in Port-au-Prince. But the situation can be reversed, he said. It is not just a symbol, it is the sign of the progressive return of the state. His visit came shortly after the United Nations High Commissioner for Human Rights, Volker Turk, reported that at least 2,300 people have been killed in Haiti since the start of the year as a result of gang violence, alongside more than 100 injuries and nearly 100 kidnappings. The figures were presented during the opening of the 62nd session of the UN Human Rights Council, where Turk warned of the scale of insecurity facing the country. Guterres said he had met members of the newly mandated Gang Suppression Force, GSF, describing its deployment as a real chance to reverse violence and restore the authority of the state. This is our SXM Daily Newscast. Thank you for joining us.